And you're based in Geneva?
Yeah, we are in Geneva.
Yeah.
Yes. So
So
here,
are you in the office building or?
yes, in the office. Yeah, already. So yeah, you can just waiting a few more minutes for the more people coming in the room. And
Have some people registered for the health?
So you can see there is already one people. One.
Yes.
And I think that more people will come.
They also have the possibility to switch their camera on, isn't it?
They need to request to participate by the video. Yes.
Okay.
And then if they have any question, they will send it to you in the Zoom.
Okay. But they are able to participate with the video on, isn't it? If they have a camera.
They can ask to participate on camera, but they need to ask.
And can they still ask now? Is it too late?
It's on demand. So if someone asks, we can try to put them on the video.
Yeah, because if the numbers are small, it is better that all of them are on video. It's more effective.
Yes. So
if you can just make even without, give them the option. Because if it's like, for example, 3 or 4 or 5 people, it's better that.
Yes. Okay.
Can you hear me, Vinay and Cook? How do I pronounce your name?
Sorry, you're talking to me?
No, the others, they are not.
Yes.
And maybe you can put them also in video, Vinay and Cook.
Yes, for others, please. Do you see the button raise hands?
No, I don't see the button, so I was just saying whether.
Yes, not you, but the spectators.
Yes, is it because there are 2 people spectators?
Yes. Normally, they can request to participate. Participate.
So I can. So how do I send them a message or live chat? Okay.
By live chat, yes.
I can't chat with those 2 people, no?
Not directly, but you can you click on their name, on their profile?
Yes.
And then do you see their profile?
Meet. So I say, the profile, yes. But how do I send a message to them?
You can see the meet button.
Yes.
Okay, so with the meet button, normally you can arrange a meeting.
I think in this working group, how do I expect to interact with them,
Immediately they need to request, yes.
Excellent. Yeah. So what I can say is, friends, I think I was wondering, because it's a smaller group, maybe, Vinay, Rabjit and Cook, can you request for the video? Because if you request for the video, we can all speak in a visible manner, because we are only 4 people, and Dung is helping us. So Rabijit and Vinay and Coke, if you can request, you can connect up the video so it can be a face-to-face meeting. Anyway, so while
yes, so now
good.
Hi. Hello, Dr. Kurian.
Hello. Nice to speak to you. So I was also hoping that Rabijit and Kwok also request and come online, because it's all makes sense when it's a small group to see face to face. I think Rabijit is dropped off, or. So Vinay, you're based in Sri Lanka, right? Based in Sri Lanka.
Yes, Dr. Kurian. So I am the president of the Sarvodaya movement, which is the largest humanitarian and development organization in Sri Lanka. And my background is medicine and public health. So at the moment, I am also quite extensively involved in the COVID-19 response in Sri Lanka, mainly at the community level and mobilizing communities. And so it's a very challenging time, and I'm quite interested in this subject because we are an organization inspired by Buddhist and Andean thinking, and we have been around for the last 62 years in Sri Lanka. And our development philosophy is highly rooted in spiritual values, but we work across all different ethnic and religious groups in Sri Lanka. So I'm quite interested in the health part of it, although this is a new subject, this impact investment, though we have our own finance arm. It's a development finance company, which is a semi-bank, and which is the only institution which is owned by a charity in Sri Lanka, large majority of the shares. And we are trying to evolve an alternative economic system and looking for really social impact investors. So that's my background here.
Thank you so much, Vinay. Kwok, I don't know whether you are Kwok Bin Hyung. You are also in the room, and Rabijit was also not in the room. I'm in the room, but they have not. But I hope you can hear me. It's myself. I'm based in Geneva. I come from. I coordinate the Clinical Advocacy Alliance, but my own background is as a medical doctor. I've been working in the social field quite a bit, and of course, also in the interfaith, because I am from Malaysia, but of Indian origin, and I'm very deeply interested in Buddhism and Confucianism, Islam, etc. So, in fact, since you're from the Sarvodaya movement, the first book I read on Buddhism was from the Raupola, one of the Buddhist famous monks in Sri Lanka.
Yeah, Valpola Rahula. Yes.
Raupola Rahula's book, and it has deeply influenced me. And but let's set the scene a little bit. But I would just like to facilitate some discussion. But just setting the scene, just to say that in the health investment area, there are 3 key pathways. The 3 pathways. Once you can send me the email, I can. We can continue the discussion after this as well. One is the health and security pathway. I mean, this is the second is the social equity pathway, and the third is the economic and innovation pathway. These are I'm just referring to some standard principles purported, but just to set the scene. So in the health and security pathway, we look at increasing the life expectancy, improving quality of life, building human capital. The second is enhancing the labor, productivity, their activity. The third is the kind of a national and global health security. So in the sense security that they have a good system in place so that people are assured of their health. The second is the social equity pathway is much broader, where we are trying to reduce the health gap and the kind of social gradient that is between genders, between communities, geographic communities. So kind of a building the social capital. Also, it means that there is a political stability, employment opportunities for women and men, young people, poorest people. And the third is basically economic innovation pathways is investments in employment, building skills, etc., etc., security. So when we look at all these three pathways, there's a lot of policy considerations from the government, from the so you can see that health is not just in this COVID context. We are thinking of vaccination, so we are but which is important, but when you look at the various issues, there are various aspects, like child focus. How is the child health? Are they, in the first 1,000 days of their birth, pregnancy to birth? How are they keeping? Because that in pregnancy itself, if there is less, if the children are born in low birth weight, and then the capacity for the whole life is incapacitated. Then about throughout the age, what are the facilities? Then education opportunities, non-communicable diseases. Now, for example, in many of the European countries, what they found that when the level of obesity in the community is more, the COVID is more impacting. So it is just not the malnutrition, but also what kind of nutrition. If we don't have possibilities for good and healthy food, there are poorer communities. Now we are having a mixture of both obesity and undernutrition. So lot of empty calories available. Poor people are buying cheap foods, etc. So obesity making and heart attacks. So in the non-communicable diseases, and of course communicable diseases like COVID. So then the issues of mental health, and as faith communities we know. So then the health infrastructure, etc. So you see, it's very broad. But when we look at investments, there are various ways in which you can promote good investment that will improve health. It could be education, it could be community development, it could be making the environment proper. So finally, concluding, I can say in this input, very important is also the whole environment. So, for example, environment, lot of trees, if young people need to be able to, if there is an urban center where there is no possibility for young people to have games and sports, then they are more into just going into unhealthy habits, etc., or maybe some kind of hanging around with young people in the streets without any possibility of a kind of an environment for games. So the environment, and also greenery, curbing air pollution, and all goes towards building resilient communities. So like your movement, Sarvodaya movement, you're not just looking at just having a dispensary, you're looking at the holistic way. So that is the correct way. So what I want to set the scene for discussion is that investing in innovative investing in health is very broad, in all these different pathways. So let us hear and discuss and learn from each other, please.
Thank you, Manoj. I think it's very interesting, and you gave a very comprehensive overview. I just want to check how many people are attending. Only myself, or are there others also in the conference? Or? Your mic is muted.
Okay,
Yeah.
Rabijit is technical. Yes, Vinay is there. Okay. So, and we'll invite you to the video. So Dung said, yes, he is hearing, no problem. And Rabijit said he is giving a technical support. So basically it's three of us. Sorry, actually, Dung is also in. Yeah, I mean, Kok Bin Hung has not mentioned anything. Anyway, so
Okay.
I think
So yeah,
we both.
yeah.
It is
So,
basically, yeah.
right. So, in the case of Sri Lanka, as you know, we have a very comprehensive state-run healthcare delivery system, and it's quite equitable and by and large had performed really well and achieved significant results for a low-income country. And it's a by and large a very equitable healthcare system, universally free, and however, the problems that you mentioned, in terms of disparities, there are geographic disparities, ethnic disparities, and also socioeconomic disparities. And so, even though the healthcare at the point of delivery is free, you still don't get the same health outcome. So that's one part of it. So we can be satisfied comparatively to the other countries on our performance, but I'm not happy as a public health practitioner and a development practitioner. We need to address some of these social determinants of health. So that's one part of it. The other is that, as you mentioned, the disease profile is we are not. I mean, the double burden of disease, not just the rising NCDs, and also, as you say, we are seeing both the extremes of malnutrition to undernutrition to obesity. So I think the way that we have to address now, I can't really still comprehend how these social investments or impact investment work in our country setting right now, because the private sector is also thriving really well. So the areas that I'm interested is really one thing you already mentioned, say food security, nutrition. Those are actually addressing the health needs. So if there are ways in which we can look at investments in not in clinical care facility, that's not required. At least in Sri Lanka, that's not required.
Mm-hmm.
What is required is really how you address some of the key determinants of health, and I would pick nutrition as one, and then work on things like food security, strengthening home gardening in a big scale, right? And then how to have management systems, how to give them initial, high quality seeds to, technology support, things like that. We are very interested, and we have already identified how we can try out some of these decentralized models where community-based organizations can come up with a project plan, do an assessment of these are the level of nutrition, undernutrition to malnutrition, to other specific micronutrient issues, and then how can we as the village get organized. So what is the financial capital requirement, what is the technical capacity development requirement, and then how do we organize. So we are trying out similar schemes right now. So that is our approach, and I'll be very happy to hear other possible approaches that you are familiar with or from others who are participating.
Yes, I was just looking at the chat box. There is Van Juan is also there. Would you like to request to come and Van and come to the video if you want to speak? That's also a possibility. So we can also see, because it's a small group, face to face and discuss. So thank you so much, Vinay. It is true. Sri Lanka is, is a good success story in compared to many South Asian countries. But as you said, we have to look at ways to move forward. So a lot of it, I think the way you're moving forward, from what I hear, is the right approach. It's giving more power to the people. That means, helping the grassroots organizations to organize themselves, because what happens is their needs they can sense what their needs are most. And since Sarvodaya, when you are a community-based organization, you are able to better understand the needs of your people. So in seeds, etc., what is very important is also not to go into try to get replicable seeds, and which is closer to adapted to your have to come to an understanding, not just with companies but also with the national agriculture departments. What are the indigenous very good yielding seeds? Is there somewhere in which is there a possibility for when you think of livelihoods, it might be like, of course ours is not based on agriculture, but in a way how could it be useful? So in a way, having a collective, maybe there is a school where the food can be sourced locally. It could be a cooperative where they want to sell it to the neighboring these products to the as a bio, as pesticide free, etc. So those kind of use, it'll be important for you to look at eco-friendly models which might be appealing to modern consumers. So that is linked to agriculture. But the issue is, how can also some of these produce be sourced back to their homes? Because what happens is sometimes, we have a very good product at home, but it's like, and we sell it and then we buy cheap packaged food. So it is not only the income, but also the possibility for this nutrition coming back to the community. But then you might think, who will be interested to invest in such things? So this could be, so it could be kind of a cooperative also, cooperative where it is not only for sales far away, but it also for sale within the community. So there could be business models that is possible in all these, to improve the livelihoods. Because one of the big issues is also, when you look into cities or look into big plantations. I mean, Sri Lanka produces good tea, but you should understand that these monocultures have replaced a lot of vibrant forests and vibrant mixed agriculture. So I'm not decrying that.
Biodiversity. Yeah. Our biodiversity is destroyed. The biodiversity.
Yes, exactly. So we need those kinds of cultivation industries that will also strengthen the environment, and a lot of it is also the possibility for these marginalized communities to be able to improve the quality of life. Could be also youth programs and youth centers, where they have able to come and play things and learn new things, and using the connectivity, using Zoom and these mechanisms where you can have where the whole Sarvodaya movement has got, like different centers where you have if you are in a larger area, you may have small places where you have a internet connected display screen where you have a possibility for weekly sessions, coming together.
We are already doing some of these networking sessions. Yeah,
Exactly. So I think these kinds of examples you need to document. And also that's also, as a scientist, we are all public health people. So we say, well, we are doing this mechanism. And like, for example, so with this working group, we are saying it's a simple technology. We can have it in Zoom, we can have a breakout room. This could be done. We are doing it, from our context. In the last 1 year, it was a devastating because no possibility for meetings. But what we found was, this training programs, we have improved our in-reach and outreach through the technology. So, for example, when I was helping organizing an international interfaith conference where about 1,000 people were part of it, the conference. But what we did was we had, it was an international conference, but we facilitated small groups of communities to get together. And because they don't have this internet connection, so the young people, groups of people living with disability, young people, and sometimes in different language groups. So what we do is we brought 5-10 people together, and they connected to this international conference, and simultaneously we were able to get, if it is a local language was not translated centrally, there was an interpreter got into that place. So so we had a, hi Van, wonderful. Maybe you can request for the video as well. So what we found was that suddenly these international conferences could reach out to the very remote places, and they found it very empowering also. So this kind of connectivity, this situation can be changed. So for this, you need investment. So this could be from investors saying that, can you help? And so we have to look at the advantages. What are the possibilities for these investments? What is the incentive for these investors for these to improve these? It could be, but of course we have to look at ethical guidelines. It is just not to push a particular product, but looking at the general, like when a community, young people are connected, and every week they are able to get input on health, and getting them into training schools, you can channel them to education. Yeah, this is just an idea. Yeah, please. Any other? Van, can you also come in and speak, or you're muted if you can. Vinay, your video is cut. Have you cut the video?
Sorry, I just got a call.
Yeah, Van, maybe it's good for us to hear. Van, you're based in Germany, isn't it? Yes, Van, you can. Yeah. So in this awareness, in this global health crisis, you can see that one of the big issues is about vaccination also. So that's the other issue. Is human resources? What are the limitations for vaccinations? So it is very clear in the macro level, at the country level, policy making is very important, because we can't do these things at the community level. What we can do is we can encourage people to take up the vaccine, because even if the country provides lots of vaccine, if there is vaccine hesitancy in the community, it's completely useless. So that is the other aspect of investment also. We have to invest into our communities, spending time. So when you talk about investment, it's also investing time. It also means investing capacity. So investing capacity means, with your dreams to be made, you need capacity, you need people to be engaged. You need them to be able to afford to pay salaries, because people can't always do it. You can't just depend on volunteers. Of course, voluntary, you can depend on a lot of voluntary, but there needs paid capacity to do some of these work. So where do we raise the money for that is the other issue. How does it, I mean, if the community finds the benefit, then you can generate part of the money from the community itself. So these are some of the ideas that we have to invest into, because I mean, health, unfortunately, the benefits of health is not necessarily seen immediately. And public health investment is long-term. So for a long-term investment, you need a vision. Yes, Van, you have some thoughts on this discussions? Yes, Vinay. Multitasking.
Sorry. Did you ask me a question?
No. I was just waiting for. I was asking Van the question, but I probably
okay.
he's not.
Can Van hear us? And we'd like to hear from because Manoj, I thought in fact I was interested in jumping into another group. So
Yes,
I'll be very
you can do
happy
that. Carry on, no problem.
Yeah, happy to hear from Van.
Yeah. I don't know. He's not hearing, or probably he's because he's based in Germany. It's still 6:40 in the morning, so he would have connected up. And Vinay, what we can do is, just send me your email. Type in your email. Let's keep in touch, because I think it's
yeah, certainly, very much so. Yes.
Shall I also? I will also type my email, because there are a lot of things that we can very interested to, because mine is also very yes, okay, because I would be very interested to hear what you're doing, and also we can also do some some other activities. We can plan about it, because the issue is about I also run a campaign called Food for the Food for All. It's called the Food for Life. So I am very in fact I'm very close with the International Buddhist Foundation here in Geneva. So the Bahante, I have at least once in 2 weeks we have a conversation, and
Okay, please. He's I know him very well. Yes. I know him very well.
Yes. So
please
yes. I in fact, I would be very interested to, because we are having this food system summit, Vinay, and I would very much like to, because in the food system summit there are 5 different working groups.
Yeah.
And what I am very interested is to develop a discussion on the values, because what we find is that the when you look at consumption patterns, I can give you more details. Okay. And I want to bring in the faith values. So
right.
Okay.
Right.
So if you want to jump to another group, please carry on.
Yeah. I think there are other people also joining.
Yeah.
Great. So really nice meeting you, Manoj, and I'll be in touch, right? I will send you an email. Okay.
Yeah.
Thank you.
Yes, Tommy, welcome.
Yeah, hi, I'm Tommy Letu. I'm come from Vietnam. I'm working in the health business. And in fact, right now, my company, is the partner of a big project in Vietnam. Mainly is building an hospital system and research, medical and pharmaceutical research institute, and do some working on a university for the pharmacies and medical.
Oh, wonderful!
Because the necessity of the numbers of young physicians and pharmacists in Vietnam is very limited. A number of physicians, doctors, medical doctors in Vietnam is about 0.7 per 1,000 population people. So very slow in compare with the average in the Western countries. Yeah, and also for the pharmacists who graduated and now working, nationwide in Vietnam is very low, about 0.2, per 1,000 people. So therefore, my groups would like to invest in a big project in Ho Chi Minh City, in the south, in Saigon, before Ho Chi Minh City. And we have 450 acres of land, and we have a project ready to go. But you understand that because of limitation of the investment capitals. Therefore, right now we try to reach out and talk to a lot of investors around the world. And I was referred by my friends, and who is Dr. George Jakowski, the one living in Toronto, Canada. He have 200 medical patents. He said, Tommy, why don't you join to this group? It may help you out. And we have a plan to invite Dr. George Jakowski in Toronto, Canada, and his friends, medical doctor, scientists, and join with us in training some course in for the medical students and pharmacy students in our future university in Vietnam. Yeah. I came here to the room late, therefore I did not hear what you share with the other guests.
Yeah,
so I'm sorry about that. So.
There is no problem. I can share a little bit because I don't know how much more time we have. I think it's half an hour more, or since it's
yeah, half an hour more. Yeah.
Yes. Or 20 minutes. I think 7:10 till 7:10. I was very, very, I have shared with you, in my email, we can continue to, you can also share the email and we can
Yes.
continue to communicate. What I was saying in health investment, because, generally there are three pathways towards health. So you raised a very real issue, so I can connect up with that.
Yes.
One is the health and security pathway. Health and security pathway is actually increasing life expectations, enhancing the labor and productivity and activity, and having a national and international health security.
Yes.
The next pathway is social equity pathway, where we have reduce the health gap among the people, rich and the poor, men and women, etc., the young and old. The third is the economic innovation pathway, where there is direct investment as you are planning,
yes,
building skills, employment, etc. In Vietnam, in many ways, has really improved and taken a lot of people out of poverty, and it's a phenomenal success story. But what you are looking beyond this, and that is what is very important, that you want things to get even better. And so in that sense, I think networking, connecting with people. And what is so beautiful in a way for you, the advantage for you in Vietnam is that you have a very dynamic population, young population, who are very productive. So, so in a way that, if you want to expand industries, if you invest in developing the human capital and their health, because one of the challenges is not only when you say malnutrition, it's also that people are sitting in front of the computers, they are eating junk food, there is more obesity, there is more non-communicable diseases. So the impact is very complex. So, but there are possibilities to invest and develop further in our community. So, I can go a little bit more, but the idea is that the investment should focus not only on individual health but also community health. It's also environment, etc. Environment and building resilient communities. How are we engaging the youth?
Yes, exactly. Yeah.
So the faith is very important because in the Vietnamese, whether if you have Christian or if you have from the Buddhist faith, yes, of the Mahayana Buddhist traditions, you have tremendous capital, in your traditions, etc. So, and also there is a history of very good international cooperation in Vietnam. When you look at the life and how Yersin, from he's from Switzerland, and France, and the great scientist Yersin who developed the vaccine against plague, and who identified he lived in Vietnam, and he was successful because he lived with the community. So there would be an important way in which.
Yes, Mr. Koreans, I totally, agree with you, and very glad to hear what you share with me regarding the community health and about the young who involved in the health activities in Vietnam, as well as the other place in the world. I very appreciate it. Actually, I'm living in America, but because Vietnam is my country, and therefore I am here. And when I go through from the north to the south and go to many hospitals, and I see that the number of beds in the hospital are very short in compare with per thousand, population people. Therefore, I have an idea. I bring that idea to the United States, talking to my partners, and join with some investors in Vietnam and the government of Vietnam. And therefore, the government of Vietnam in Hanoi at the ministry level, and they give us a good project, a nice project with all the permits and everything. It's ready to go. And that's, my big plan. A plan because I came back to my country, my mother, therefore I want to do something. And I'm glad that I involved in this room and talking directly to you. And, maybe you, through this room, through this dialogue, you understand that the people of Vietnam, they have that aspiration to build the whole hospital system, build a nice university to train the new doctors, young pharmacists, and young nurses to provide their help to the whole country, especially to the poor, to the community. So I'm very glad. And your point of view is same of mine.
I was just thinking, in a sense that when you are developing an institution, very very important is to look at the sustainability of the institution, and also to look at what they will do after training.
Yes,
this is very important, and Cook and other participants, if you would like to say something to this discussion, please welcome. I mean, they're also having Vietnamese background, so if you can also join in, please, it'll be great. Because I think, there are a lot of possibilities, as you said. The other is also, looking at when you're talking about the land, there is also about traditional herbal and traditional medicines. So there is a lot of demand for many of these issues. So, pharmaceutical, nature-based cures. So I think, then of course the local markets. So the local market people, as you said, you are looking at
Mr. Korean, may I share with you some of my idea regarding the pharmaceutical, products?
Yes.
It happened to know that Dr. George Jackowski in Canada, the one who have 200 medical patents, and his aspiration, his dream is to work with me in Vietnam and to manufacture about more than 40 product we call the generic drug. Yeah, because we look at the situation in the market in Vietnam, each year imported about 6-7 billion USD regarding the pharmaceutical product. And that Dr. George Zakowski mentioned, Tommy, why don't you go and talk to the Ministry of Health in Vietnam and create or produce the generic drug, and you can lower the cost about 5-10 times. And why don't we use that product and distribute or sell to the community, the poor community in Vietnam and all the country in Southeast Asia? And thus I bear the idea, and I think that if Vietnam can produce generic drugs, that's beautiful. And my project in the one that you introduced in Ho Chi Minh City in Saigon is a big project, and we intend to have that field that we producing generic drug. So that's the reason why. My question to you, Mr. Korean, is that good now in this market, in the Southeast Asia market, in the poor country? Yeah, we can produce generic drug for the vast majority of the population instead of importing drug medicine, at higher costs in Western countries.
Yes, I think it's a good. When you look at the pharmaceutical, you have to really also look at the markets, because what happens is, as you are thinking, there are many others also thinking in the same lines. So, for example, you can also think of, so when you are rolling a project, you will have to think of, in the next 5 years.
Yes, exactly.
Who are the other people who will be coming? Because you may have competition from Thailand, you may have competition from Indonesia. So
exactly, yes.
These are the things that you have to think of. So maybe you may have to have a kind of a collaborative approach with some of the generic manufacturers in those countries, and so that you have an understanding. Then the other aspect is also the primary ingredients for the generic markets are also coming mostly from some countries like China. So that is also could be an impediment in the future. So you have to look at because the components of these medicines, many of them are coming from big countries. So maybe you'll have to think of those supplies. Then you may also maybe get some market assurance with some of your. So if you're going to invest in these things, an important aspect is to get an idea where your markets are going to be.
Yeah.
And it has to be way beyond Vietnam itself, because for you to expand. So but I think investing in Vietnam would be safer for you than investing in any other country, because the country, the people. Because one of the big challenges is investing in a different country is also for you to have security and to understand the environment. So
Mr. Korean, that's true. But the fact that we are having right now is the whole project is ready to go, and everything and all the ideas are set, and all the approval from the government we already got. But the thing is, we need support from our overseas investors. Maybe through this room, or some investor gonna hear it and can provide us some help. Okay, but the country of Vietnam do need investor come from other country, because anyway, you understand that the country of Vietnam is still an underdeveloping country, so we do need, and through this forum, I hope that we can get some investor can help us with the ideas, with the investment capitals. And that's something that in that field we have a very limiting contact with the investors. And if Mr. Koreans, through your forum, I hope that I can have a chance to contact with you later through email, and everything, and maybe your opinion, your advice are very helpful to us to make, implement our project in Vietnam.
Most definitely. I mean, you have my email in the chat box. So I am not an expert in issues of finances, but I am a technical. I am a public health person.
Yes.
I have studied health systems management, and I've worked in the field for a long time. But this whole network of the Space Invest and Agape, they also bring together investors. So I think it's important that you put forward these ideas and look at possible investors. And I think people are looking. You have to have a clear plan. And a set of with the transparency. So I have I just write. I will just give you my email.
Yes, please. Yes.
And I think I can definitely work with you and to help you in whichever way I can. But the point is, these are big projects and you need
but first of all, I really appreciate all your opinions or your ideas that would help. Okay, and the next step, if about the financial matters, that's something next. But I know that you have such a tremendous experience in the health sector. So I think that all your opinions are very helpful to our project in Vietnam.
What happens is, it's like this, when I can give you a kind of coming from our cultures, I just tell you, when you it's like a story, an image, when doves, the doves, pigeons.
Yes.
If you want to bring pigeons, you don't bring pigeons. You make a nest for them in your house, and they will come and make the nest. So you don't buy a pigeon and bring it and put it in it. Usually, the bird. So the idea is that a good investment, it's to develop that. I'm sure you already have it, but in the sense to develop a kind of a good package, which is very attractive and which you also start in a small way. You don't have to wait all the money to come to start the project. I mean, you have to start in a particular unit with one product, and then and then show that it works. And so so people are always interested to invest in something that seems to work. So these are some of the tips, and to start in a way that a particular project. I'm not saying it has to start small; it could be big, but start, and that becomes your kind of showpiece. And if you are able to have good systems in which accountability and the shareholders are transparency in how the investment is used, and with the social capital, as you said, and Vietnam is is a very good country in many ways, and also with the increasing geopolitical polarity in the world. The world is not looking at big powers. World is shying away from big powers. They want even the smaller countries to take on more bigger responsibilities. And the Vietnamese people have a great history of tremendous resilience. The only people who have defeated and all the fires.
It surprised me. You still remember about those stories of Vietnam. I very admire you, Mr. Kurian. Yeah, I admire you.
I admire the Vietnamese people very much. I have never visited Vietnam, but it's it's a tremendous story of resilience of people. And I'm not saying I agree with all the policies and things like that, but as a people who have kept their culture and who have struggled through difficult times and difficult occupations, etc. So I think it's a great place to invest and
yes.
And to but I'm sure you will be able to, but education is a tricky field in which you have to. My advice would be that also you connect up with something.
Mr. Korean, so to me, I think the education is very important, especially at the graduate level. When the student finish high school and go into the university, and the facility in Vietnam is very limited in compare with other countries like in Europe or America. So I look at that situation, and then I want the youth, the young people, most of them should be trained, in college, in university, at that level, because most of the people in Vietnam, because of the financial problems of each family, and most young people cannot graduate, finish college or university level. They finish high school, and most of them drop out. So it's not the very skilled people. And I think this generation, Vietnam have start having a good economy situation, so it should train the young people with the good knowledge, good skill, and after finishing university, they went out and provide their service to the community. So I like that idea.
I'm so glad that you are doing this, Mr. Tommy. I mean, I appreciate your whole team. I appreciate that that Van is also part of your team. I'm also a faculty with the Kent State University, adjunct faculty, so on public health.
Oh, I see.
Yeah. So I teach as a professor there in the US, online and all that. So anything you require, some ideas on this training, I could also contribute.
Yeah.
So and also I would like to appreciate that you who are now living abroad and now wanting to go back to your country and to help your people. It's a very noble
thank you
intention, and I hope and pray that you will succeed.
Thank you, Mr. Korean. Yeah, that encouraged me a lot. Helped me a lot. Even though my family is still living in the United States, but because I'm a Vietnamese, I go wherever in the world. Vietnam is the country where I was born, so therefore I want that I come back and do something. And Mr. Korean, may I have your email, please?
Yes, I have sent in the chat.
You sent to me already? Yes.
You can also send your email by chat box, and I can communicate with you.
Okay. Thank you. Okay.
So it's a meeting of minds, and meeting people. Networking is very important, and but I think it's important to try out different connections and see all the possibilities.
Yes.
And the solutions may not come from one place, and this is what I think. Mentoring and solutions. You may have to develop different alliances, but as long as your core business and a core project is transparent and accountable, you will find people to invest. And
yes.
Yes. So I think we may have a few more minutes, but I think it's 7:10.
Okay, so I thank you very much for the opportunity to have a chance to talk to you directly, Mr. Korean.
But let's keep it.
So now I reserve the time to all the guests.
No, the others
I see here.
Yeah.
Is there any other guests? I see. No.
Yeah, Van is part of your team.
Yes.
Van Huan's part of it, and Kwok is also part of your team.
Mr. Van is the one who based in Germany, and he's my partner to work with the people outside Vietnam, and I'm inside. Yeah, because this project, both Mr. Van Huan and me are very, like it, and we want to start, the project.
Any other parting comments from Van or from Coke? Coke Bin Hyun?
Yeah, I would like to just remind you that the room will be closed in 3 minutes.
Okay.
Hello everyone. Anh Dòng nói chuyện từ nãy giờ cả 45 phút.
Hello everyone.
Yes, Kwok. Yeah, nice to see you. Would you like to share some thoughts? Thank you, Kwok, for wonderful. That I hope you found some of these discussions useful. So we are now concluding in about a couple of minutes. But let me just say that investing, to conclude in a sentence, investing in health is so vital.
Xin lỗi, trong cái sector của mình các anh có ai biết nói tiếng Việt không?
Vâng, rồi Quốc nói đi, tôi Tommy tôi nói tiếng Việt mà. Hai Quốc.
Good.
Yeah, can speak in Vietnam.
Yeah, good. Please go ahead. With each other, please do.
Dạ, nếu như anh có chia sẻ thì anh có thể trình bày, mà phòng sẽ đóng trong khoảng 2 phút nữa.
Anh Quốc nói chuyện
mọi người
đi,
nghe
phòng
có rõ không ạ? Mọi người nghe có rõ không ạ?
Rõ, nói go ahead, nói chuyện đi Quốc ơi.
Tôi tên là Bình ạ. Dạ, xin giới thiệu với các anh, tôi tên là Bình ạ. Dạ. Xin lỗi là vì cái mạng internet bên này nó không tốt lắm. Và tôi lại cũng không biết nói tiếng Anh thì kém, cho nên là có thể nói vài câu bằng tiếng Việt được không ạ?
Dạ được ạ.
Mr. Korean, so may I have a few words?
Yes,
Mr. Bin, the second guest, he's maybe based in Vietnam, and therefore he wants to speak a few words in Vietnamese.
Yes,
okay.
please.
He cannot speak English.
No
Okay,
problem.
so Bình cứ nói chuyện với Bình ơi.
Dạ, tại vì cái phòng này tôi bị đóng trong 1 phút nữa nha anh, cho nên là có gì liên lạc sau.
Tôi chỉ muốn giới thiệu một chút thôi ạ. Tôi tham gia hơi muộn cho nên là bây giờ mới vào. Tôi làm việc trong ngành chăm sóc sức khỏe bằng môn diện trần điều khiển liệu pháp của giáo sư Bùi Quốc Châu ạ. Và tôi là một người đại diện cho giáo sư Bùi Quốc Châu ở Hà Nội. Thì cũng được biết cái hội thảo này cho nên có tham gia qua một người bạn. Và xin chào các anh.
Mr. Bin is working in the health sector in Vietnam. He's working with the professor Bùi Quốc Châu.
Yeah.
Vâng. He's sorry that he's coming to the room late, but he would like to introduce his company. His professors mainly do the treatment to the community.